Hi, everyone. This is Larry Levitt, Executive Vice President for Health Policy at the Kaiser Family Foundation. As many of you know, KFF's offices in San Francisco, Washington, D.C., and elsewhere across the country are physically closed, but we are hardly closed for business and have put out an enormous amount of information in just the last few days to inform public discussion and debate around how to respond to the coronavirus pandemic and the economic dislocation caused by it. We are being hit with a double whammy of a public health crisis and an economic crisis on a global scale. The policy debate right now is not only about how to protect the public's health, but also about stimulating the economy and providing a safety net for low-wage workers and those who become sick. Given how fast everything is moving, we wanted to bring together our top experts to answer any questions you might have. I can't promise none of them are in their PJs, but that won't do anything to blunt their expertise. We have a broad range of experts on the call who work on the whole range of issues KFF focuses on, including Medicare, Medicaid, private insurance, the uninsured, the Affordable Care Act, healthcare costs and affordability, women's health, immigration and racial disparities in health, global health, and public opinion. We won't be able to answer everything, but we'll do our best we can and refer you to others if we don't have the expertise. We're going to start with a brief presentation on our latest poll just released and then move on to questions you have on that or anything else. Ask your questions at any time using the chat functions on the web dashboard. With that, I'll turn it over to Liz Hamill, our Director of Public Opinion and Survey Research.
Hi, everyone. Let me start by saying that I hope you and your families are all healthy and managing whatever life disruptions you might be experiencing right now. I'm going to run through some of the key findings from the poll we released yesterday. This was a telephone survey using landlines and cell phones with a random sample of U.S. adults ages 18 and over. It was in the field Wednesday through Sunday. And a full report on the survey, including the methodology, is available on our website, so I won't go through all those details right now. But I would like to add the caveat that things on the ground are moving really quickly, and we saw changes in the data even over the 5-day field period. So the results I'm going to show you are probably an underestimate of where things are today and where they'll be in the coming days and weeks. Can we move to the next slide, please? So starting with people's worries and concerns, you can see here that most prominently about 6 in 10 people said they were worried about themselves or a family member getting sick from the virus, but worries about some of the economic consequences are common as well, including about half who were worried about lost income either from investments or from work closures, and 1/3 who were worried that they won't be able to afford testing or treatment if they need it. That particular worry rose to 2/3 among those without health insurance. Next slide. When we look at work-related worries, we find that lower-income workers and those who work part-time or get paid by the hour or by the job are much more likely to be worried about losing income due to a workplace closure or reduced hours. These workers are also much more likely to worry that they'll risk exposing themselves to the virus because they can't afford to miss work. I think a notable point, the data is not on this slide, but this also includes 4 in 10 people who either work in a healthcare delivery setting or live with someone who does. And this group is on the front lines and at particularly high risk for exposure, so it's concerning that so many of them worry about not being able to miss work for financial reasons. Next slide, please. Here you see those same groups, the lower income workers, part-time and non-salaried workers, are much less likely than others to say that their employer offers them paid sick leave or paid time off to care for a sick family member. So they have an added pressure to show up at work. Next slide. We also found that 1 in 10 workers say they've already lost income from a job or business due to the virus, and that includes almost 1/4 of the self-employed and about 1 in 5 of those who are employed part-time or paid by the job. Again, this is something I expect we'll see growth in over time when we track this, as many communities are mandating that only essential businesses remain open. Next slide, please. So over the entire survey field period, 4 in 10 Americans said their lives had been disrupted a lot or some by the outbreak. And this is one of those questions that changed rapidly over the days we were in the field. By the weekend, that response was up to 50%. Some groups stood out as more likely to say their lives were disrupted, including women, Hispanic Americans, and parents with a child under age 18 living in the household. For parents who said that their child's school or daycare had been closed, fully 2/3 said their lives had been disrupted. Next slide. We also found that parents' ability to deal with these disruptions, again, varies greatly based on their income and employment situation. So lower income parents, those who do not get paid family leave at their jobs, and those paid by the hour or by the job are more likely than other parents to say it would be difficult for them to find alternative childcare if their child's school or daycare was closed for at least 2 weeks. And as we're learning now in California and other states, it looks like those school closures are going to last a lot longer. Next slide, please. These disruptions and worries are already taking a toll for some people. We found that about 1/3 of people felt that worry and stress related to coronavirus has had a negative impact on their mental health, and this includes 14% who say it's had a major negative impact. Next slide, please. We also asked people about the kinds of actions they're taking in terms of precautions or preparations, and we found that about 2/3 of the public reported taking at least one of several actions, including changing travel plans, canceling large gatherings, stocking up on supplies, and staying home instead of going to regular activities. One thing that was surprising to us was that the people who are most at risk from serious complications, so those ages 60 and over, and those who either have a chronic condition themselves or live with someone who does, these people at this point were not more likely than the general population to report taking these precautions. They reported them at similar rates to everyone else. Next slide. Other polls have been reporting on partisan differences in responses to the outbreak, and we found this as well, not only in ratings of politicians' handling of the crisis, but also in terms of how seriously people view the situation. And in fact, we found that rather than dividing by risk group, there was a large partisan divide in the share who reported taking precautionary actions. So you can see here that about half of Republicans, compared with 80% of Democrats, reported taking at least one of these actions. There were lots of other partisan differences in the survey too, in terms of how much people said their lives had been disrupted and how worried they were about the personal effects. So it'll be interesting to track these going forward as the disease is hitting home in more communities to see if these differences remain or if they subside as more people are seeing the effects of the crisis on the ground. Next slide. When it comes to who people trust for reliable information on the disease, the most universally trusted source is the CDC, but you see that the WHO and state and local government officials also get high levels of trust across partisan groups. There is a big partisan divergence, however, in trust in the news media and in President Trump as a source of information on coronavirus. And you see that a large share of Democrats trust the media and a large share of Republicans trust President Trump, which may help explain some of the differing responses to the other questions in the survey. Next slide, please. One encouraging finding from the survey was that most people seem to have gotten the message about most of the basic facts about coronavirus transmission, symptoms, and who is most at risk. You see a few points of confusion here, but overwhelming shares know the basic recommendations for how to slow the spread of the disease, including frequent hand washing, staying home if sick, and avoiding large gatherings. Next slide, please. One potential knowledge gap that may have implications in the coming days and weeks as more cases emerge is that about 1/4 of the public overall, including almost 4 in 10 of those with lower incomes, think that someone who is infected or thinks they are infected should seek care immediately at an ER or urgent care facility rather than staying home and calling their doctor. And with a growing concern about potential strains on hospitals and healthcare facilities, this seems like a particularly important message for the public to grasp as the epidemic progresses. So we will continue tracking things with future surveys and have more data available as quickly as we can. Those are the highlights I have to present for now, and I'll turn it back over to Larry to get the discussion started.
Thanks, Liz. And as I said, ask any questions you may have. We'll try to answer them about the public opinion data Liz just presented or anything else related to health policy and the coronavirus pandemic. And you can ask your questions on the web through the chat function. So I'm going to start with a question from Maria Sacchetti from the Washington Post, who asked about the vulnerability of people in nursing homes. And we actually recently just put out a brief on that. Robin Rudowitz, you could take that one.
Sure. As Larry mentioned, we put out a brief on how coronavirus might affect residents in nursing homes. There are 1.2 million people in nursing, or 1.3 million residents in nursing homes across the country, and certainly they are more at risk for coronavirus. They already are more likely to have higher incidence of respiratory issues, and other, and their age makes them more vulnerable. CMS did put out some guidance related to how nursing homes can help mitigate spread related to restricting visitors and volunteers and non-essential healthcare personnel, canceling group activities and communal dining, and doing some more active screening. But it is an issue, and those residents are definitely at higher risk.
Larry, this is Tricia. Can I just add one point?
Yep, please do.
Which is a lot of the attention has been on nursing homes, and for good reason, because of what we've seen in Washington State. There's been less attention on assisted living facilities and other residential facilities for older people, mainly because the federal government has less ability to impose regulations on these facilities. But these are also older people at relatively high risk, and they're close to 1 million people who are living in assisted living facilities. And so that is an area that clearly warrants further attention and messaging.
And I would just add, we also put out an analysis of state-by-state analysis of how many people and what share of the population are at heightened risk for severe illness from coronavirus infection, and certainly seniors are a big part of that group, not only those in nursing facilities or assisted living, but just in general. There's a question about if people who have ACA plans may be able to defer payments of their premiums. Karen, you want to address that?
Sure. At the moment, there has not been any guidance about being able to be late with your premium. There is a general rule in the marketplace for people who are receiving premium subsidies, which is about 90% of marketplace participants. They do have a grace period. They can get behind as far as 90 days. After a month of being behind on your premium, the plan will stop paying claims, however, and pend the claims. So at the moment, there is not guidance allowing people to be late on their premiums. They do have a grace period, but if they don't catch up in their premium payments before the grace period ends, their coverage might be terminated.
Next question is from Leslie Small, who asks about the analysis we just put out a couple days ago on estimating that the average inpatient admission for someone who gets ill as a result of COVID-19, the average cost under private insurance could top $20,000, and the average out-of-pocket cost could top $1,300. She asks whether it's likely that employers and insurers will raise premiums next year or make other benefit or design changes. And maybe I'll take that one. I think there's a lot of uncertainty about what the cost for health insurers will be as a result of the epidemic. We have some information about what the cost for each patient will be, but we have very little information yet about how many patients there may be. And that's the big area of uncertainty, is how widespread the infection will be and how many people will become severely ill and require hospitalization. So insurers at this point are running blind on how much the total cost may be. There's some offsetting factors as well. As hospitals delay elective surgeries, then there may be some offsetting savings for insurers as those surgeries get put off into the future. I think the way insurers are going to think about premium increases is what is the ongoing potential cost of this epidemic. Typically, regulators do not permit insurers to recoup prior year losses through premium increases. So insurers are going to be focusing a lot on what the ongoing cost of this epidemic may be. There may also be issues if insurers deplete reserves and need to replenish those reserves through premium increases next year to remain solvent. So I would say a lot of uncertainty right now around particularly how many people are going to require hospitalization and therefore what the total cost to insurers will be. There's also a question about potential surge in patients related to that and whether that could overwhelm U.S. hospitals and what we should be doing about that. I would say we are not experts in medical supply or clinical delivery of clinical care. But Josh, maybe you want to talk a little bit about the curve and how that might affect hospital capacity. And Jen Tolbert, I don't know if you want to add something about differences in capacity across states.
Sure. This is Josh Michaud, Associate Director of Global Health Policy. And yes, I mean, that is a major concern for the U.S. response and responses in other countries right now. What we are expecting to see is a continuing increase in the number of cases. And with that increase in number of cases, a portion of those cases will require hospitalization. And in certain locations around the country where we see that rapid rise, and in cases and in hospitalizations, it could quickly overwhelm or at least strain the hospital resources that are available. And mainly thinking about the availability of intensive care beds and acute care beds and emergency room space, as well as the more intensive support necessary through things like respirators, ventilators, etc. Excuse me. And it's unclear what the effect of the current social distancing and other measures that we're taking in the United States will be on blunting the future trends there. But the hope is that we would avoid somewhat of the northern Italy scenario where they are seeing resources strained. But we can't say for sure whether that we will be in a northern Italy scenario in certain locations or whether we will be able to social distance, at least mitigate some of the impact here and hopefully reduce the overwhelming resource drain on the healthcare system. I'll leave it there.
Hi, this is Jen Tolbert, and I'll just jump in. Obviously, over the past years, hospitals have been reducing beds as part of cost-saving measures, and so we are down to, on average, 2.4 beds per 1,000 population nationwide. But I think there's important variation across states, and in particular, some of the states that are particularly hard hit by COVID-19, California and Washington State, have fewer than 2 beds per 1,000 population. So I think these overall efforts to reduce the number of beds may come into play and will certainly require hospitals to take other measures to address surge and develop surge capacity as this outbreak continues.
And I would just add, we put up a state monitoring tool, which Jen Tolbert leads just this morning, which includes state policy actions around the coronavirus, as well as data like hospital beds per 1,000 by state. And we will be frequently updating and adding to that monitor. So keep an eye on it. Jen, while you have the floor, there's been in recent days reports of widespread layoffs. Can you talk a little bit about what people who get laid off, what their options are for insurance coverage, which would obviously be so important in the middle of an epidemic?
Sure. So yeah, we are in a slightly better shape to handle this situation thanks to the Affordable Care Act, which does create new insurance coverage options for people who may lose their jobs and find themselves without health insurance coverage. In states that have expanded Medicaid, some people who are no longer working may qualify for Medicaid through the expansion. And for others, there's the health insurance marketplaces where people can go and sign up for coverage. Now, they will still likely be required to pay premiums depending on income and if there's perhaps another worker in the family. But those are places where people can go to sign up for coverage should they lose their job-based coverage.
And actually, Larry, this is Karen. I would just jump in and add one other thing, since Jen mentioned some people who lose their job may be married or be eligible to be covered as a spouse or dependent under another family member's plan. And loss of your own health coverage also gives you a special enrollment period, a right to a special enrollment period into another employment-based health plan that you may be eligible for. So it would be a good idea for people to explore all of those options.
We also have a question about related again to job losses from the coronavirus outbreak, and how likely it is or the potential to alter the ACA exchange risk pool, either for better or for worse. And I can take that, but others should jump in if they want to. We may very well be in a recession or heading to a recession, and this would be the first recession since the Affordable Care Act went into effect. So we are in somewhat uncharted territory in terms of what might happen in a recession under both the ACA marketplace and the Medicaid expansion. One thing we do know about the ACA marketplace is that enrollment tends to be concentrated among the lowest income groups who get the biggest subsidies. And that's even more true in states that haven't expanded Medicaid, where people between 100 and 138% of the poverty level are eligible for marketplace subsidies. So as people lose jobs or have their work hours cut, household income is going to tend to fall, and that will put more people into that lowest income category with the broadest enrollment in the ACA marketplace. So I think that has the potential to improve the risk pool in the ACA marketplace, and shouldn't by itself have a big effect on premiums. And certainly as people lose their jobs and their incomes fall below 138% of poverty in those states that have expanded Medicaid, we're likely to see growth in Medicaid enrollment as we typically do during recessions. We have a question about the economic impact and what it means for low-wage workers. And Liz, maybe you want to start from some of our polling work and what we think the effect might be on vulnerable groups, particularly low-wage workers.
Yeah, we certainly found that in this most recent poll that those were the folks who were most worried, about losing income. We've done some other work with low-wage workers in the past, and we know that they are more likely to be living paycheck to paycheck. It's more difficult. I think the findings about parents being more difficult to find alternative child care if they are able to go to work. So I think they're, like many people, being hit not only by the economic impact, but by other disruptions in their lives as well.
And Robin Rudowitz, I don't know if you want to add something about kind of Medicaid and what we're likely to see in Medicaid, and also what options states have under waivers to expand or make it easier to enroll in Medicaid.
Sure, and I was also just going to say that there are implications for both the workers and for state budgets as well in terms of increased Medicaid enrollment and costs of all the programs that support low-wage workers when they might lose their jobs. But in terms of Medicaid, we did also put out a brief on Medicaid and how the program could be used to enhance capacity to serve people during this crisis. Certainly, there are states that are going to be coming forward with both 1135 and 1115 demonstration waivers to help ease provider restrictions to be able to serve people, as well as streamline eligibility and enrollment, so it makes it easier for people to obtain and maintain coverage through the program. So those are things through waivers, and then certainly under existing law, states can adopt the Medicaid expansion or expand or do other streamlining of eligibility and enrollment to make it easier. I would also say for the states that did expand Medicaid, the coverage in the expansion is 90% federal match. And the House bill as passed did include an increase in the federal match rate to help support the state's capacity to maintain and expand the Medicaid program during the crisis.
And Alina, for those who do have jobs but don't have paid leave, maybe you can talk about the availability of paid leave and what the House, the bill that has passed the House and is imminent or has passed the Senate would do.
Sure. This is Alina Solganikoff. Hi. This has really put a spotlight on a longstanding gap that many workers have had, both in terms of lacking paid sick leave and then over the long term paid family leave policies. And it's really varied a lot state by state, and some states really on the forefront of trying to ramp up and fill in gaps and by mandating both paid sick leave and paid family leave, although these have been very complicated issues in the past to manage, both in terms of requirements for employers and their ability to afford to offer these benefits. And so recently Congress, as part of the most recent bill that's still in play, the House approved an Emergency Paid Sick Leave Act, which would basically offer 80 hours of fully paid sick leave, which can't exceed more than $511 a day, capped at $5,110 for full-time employees who are unable to work or telework because they've either been advised to, or they're subject to quarantine, or because they themselves are experiencing symptoms of coronavirus and seeking medical diagnosis. They're also offering 80 hours of paid sick leave at 2/3 the rate of the employee's regular wages for an individual who's been advised to quarantine, or because the employee's child, their school or their daycare has been closed, or because the employer is experiencing any other condition that's specified by the Secretary of Labor. This would be available immediately for regardless of how long the employee has been employed. It also applies to part-time employees as well, but there is a limitation that it's only for people who are working for private employers who have fewer than 50 employees, and all public employers. So if you are a large employer, if you are a worker, somebody working for a large employer, more than 500 workers, and your employer does not offer you paid sick leave, this does not apply. Similarly, they have proposed a parallel benefit for paid, more extended emergency family and medical leave, and that offers some, right now we have unpaid family leave. That's the federal FMLA, which has job protection for 12 weeks for most workers, but it's been unpaid. Now this will be the same group, paid at 2/3 of the employee's regular wages, which won't exceed $200 a day. But the first 10 days may be taken unpaid if the employee doesn't have paid sick leave. And it only applies to employees who have been working already for at least 30 calendar days. And again, this applies to employers with fewer than 500 employees. And also it's for those who can't telework, or because the employee's child school or daycare has been closed because of the coronavirus. And so if you yourself are caring for a family member who is sick, this does not apply.
And I would just add, I would emphasize something in our poll, which Liz presented, which is that there's certainly a lot of pressure to telework to create social distancing, but telework is something that is not available to a large number of particularly low wage workers who may instead be forced to come into work or see their hours reduced. Got a number. Oh, I'm sorry, go ahead.
I was just going to say that there are also provisions to help people who are self-employed, which gives them a tax credit, which is equivalent to 100% of sick leave, equivalent to their salary, and 67% for family leave. So those individuals are also addressed by this bill. That's it.
I'm sorry, go ahead.
No, I said that's it.
Oh, got it. Thank you. Yes, a webinar with 20 people spread across the country is difficult. There's also been a number of questions about the workforce situation in hospitals, supplies. That's not something we have a lot of expertise in, but is there anyone who does have something to add around particularly workforce issues in hospitals and healthcare settings?
This is Jen Cates. Just a couple things, and then potentially Josh Michaud can jump in. But there is the National Disaster Medical System, which has thousands of healthcare professionals that I understand the Trump administration may be activating soon. And those are responders that can be deployed and help as needed, including in hospitals. So that is one potential surge workforce to look at. Of course, one thing to consider is that these are people that have jobs and are working, and so even if they might be in their home right now, it would take them out of their existing situation and redeploy them. Also, there are some Navy ships that are being moved, the USNS Comfort and the Mercy, and Josh is actually the perfect person to speak a little bit more about those, but they're being positioned to help offload pressure in hospitals, I think, on the East and West Coast right now, if Josh wants to add anything to that. So there are these measures that can be taken, but I don't think there's an easy answer to shoring up the workforce right now.
Yeah, this is Josh, and thanks, Jen. I would echo what Jen has said. And there has been, of course, a lot of discussion about the military's role in increasing the military support for the domestic response. And the first step in that has been at the state level, governors activating National Guard units, and we now have 22 states where National Guard units have been activated. And over 1,500 National Guard members mobilized. And most of those are concentrated in a few states, but we might expect to see that grow. Now, those are not healthcare workers mostly, or even it might be only a small portion of those might be healthcare workers. And Jen pointed to one of the difficulties of that situation, calling on the National Guards who may be health workers to function as a National Guard member in that role takes them away from their normal civilian duties, and therefore careful consideration would have to be taken to do that, and whether you might be actually causing equal harm from removing them from their civilian position. And this is a point that's been raised by the National Guard itself, and is something to be aware of. And then the broader military as well, the hospital ships appear to be being mobilized for deployment on the coasts. Unclear how that will work. But again, the staffing of those ships comes from various sources, and you have to be careful about what resources you're pulling from in order to staff the ships. The Defense Department has been reluctant to get terribly involved, and they have made statements saying that they are, concerned about the appropriateness of using their existing facilities, including the ships, because they're not built for infectious disease outbreaks. They're built for more trauma care and surgeries and humanitarian assistance in other countries. And so, of course, those issues can be dealt with and facilities can be worked on, but I think there is a limit to the amount the military can supplement in terms of healthcare workforce the shortages that we see or will likely see in hospitals in the coming weeks.
Thanks, Josh. We also had a question about what the effect of a recession might have on the healthcare sector, representing nearly 1/5 of the economy. And I can take that, and others should jump in. Historically, healthcare has been a counter recessionary force. People get sick no matter what the economy looks like. So healthcare tends to be actually one of the few engines of growth during a recession, and I would expect that to be doubly true in a recession created by a public health crisis. There are challenges. Certainly, as people lose their jobs, they're more likely to become uninsured. The Affordable Care Act is a safety net that we have not had in previous recessions, but that safety net will have more holes in some states, particularly those that have not expanded Medicaid. And as Robin mentioned earlier, as Medicaid enrollment and spending increase during recession, there will be even more demands on state budgets. The increase in the Medicaid matching rate in the bill that just passed will certainly help, but there might be pressure for an even further increase in federal funds to states for Medicaid. Anyone else have anything they want to add on that?
Larry, this is Molly. I just wanted to take it a step further, and you hate to think about politics at a time like this, but we are in the middle of a presidential election, and you just also want to think about the impact of a recession on how it's going to feed into people as we're heading into the national election. I expect, certainly economy and these economic worries are going to change the national discussion around the election. Certainly the virus itself and the healthcare system's ability to deal with it will also change the national conversation. I also just think that, we've seen some potential challenges just to, conducting the election. Last night, how many of the states were unable to go ahead and have their primary. And I think that these are all additional knock-on effects in the sense of the crisis that we're dealing with right now that are worth thinking about for the long term.
Thanks, Molly. And I think that's a good place to leave it here. As you all know, you do know how to find us, and we're happy to help in any way we can. Many questions we can answer, those that we can't, we're always available to provide tips for where else to go. So thank you all for listening. And as Liz said earlier, hope you and your families are staying safe and as sane as possible in these very difficult times. And thanks for participating this morning.